Hello, everyone, and welcome. We are excited to present tonight's webinar to you, a topic that we have not talked about in the past. Tonight's webinar is about transition of care from pediatric to adult care. I am Farah Douglas, President and CEO of the Liver Health Foundation. We are a California-based tax-exempt patient advocacy nonprofit entity representing liver patients in California. Thank you for joining us. As I mentioned, tonight's webinar is about the details of moving your child's medical care from pediatric to adult. It is a complex transition. We all know it is hard. Actually, it is very hard emotionally and psychologically to change our doctors. We get used to our doctors, we trust them, and we know they have our medical history in mind. So it is difficult for parents and young liver patients to move away from what is familiar, good, and trusted, and start a new relationship with another doctor and another hospital. In tonight's webinar, Dr. Rohit Kohli will offer information about transition of care. At the conclusion of the presentation, we will begin a roundtable discussion with a group of liver patients and their family members. They will share their stories and ask questions about transition. Some of our guests have a few years before embarking on this journey. Others either have lived through it or are about to jump on it. So, if you have any questions, please use Q&A or chat options and post your questions. Our expert will try to answer to all questions. We thank our physicians, medical centers, liver patients, and pharmaceutical companies for their support of our efforts on behalf of liver patients. Please remember, information given by our experts is not a substitute for advice given by your own physician or healthcare provider. Now, Mirum Pharmaceutical is the sponsor of tonight's program. We thank Mirum for supporting our efforts and helping us bring this information to our liver patients. It is my absolute pleasure to welcome back Dr. Rohit Kohli, our distinguished presenter tonight. Dr. Kohli has been a great supporter of our efforts in raising awareness of liver disease. Dr. Kohli, MBBS, MS, is the Chief Division of Gastroenterology, Hepatology, and Nutrition, Associate Director, the Saban Research Institute, Associate Chair in Liver and Intestinal Research at Children's Hospital, Los Angeles, Professor of Pediatrics, Clinical Scholar at Keck School of Medicine, University of Southern California. Dr. Kohli's research work has focused on the pathogenesis of obesity-related liver disease. His lab specifically investigated the role of the bile acid signaling as a mechanism for muscle and regulations of the extreme stage of this disease, which is MASH. He has published more than 160 peer-reviewed articles, including in prestigious scientific journals such as Nature, Nature Reviews, the Journal of Biological Chemistry, Gastroenterology, Hepatology, Journal of Pediatrics, and the American Journal of Physiology. Dr. Kohli is the recipient of the 2007 George Ferry Young Investigators Award from the Children's Digestive Health and Nutrition Foundation, a fellowship award from the American Association for the Study of Liver Diseases, Takeda Research Innovation Award from the North American Society for Pediatric Gastroenterology, Hepatology, and Nutrition Foundation. Dr. Kohli is a member of the American Pediatric Society, National Academy of Medicine from India, and Liver Health Foundation's Medical Advisory Council. We were proud to acknowledge Dr. Kohli's distinguished and exceptional service to our community and liver patients by offering him Liver Health Foundation's 2022 Healthcare Visionary Award, a recognition well deserved. Dr. Kohli, thank you so much, as usual, for your support. We are ready for your presentation.
Thank you very much, Farah, for the opportunity and look forward to the discussion that will follow after my short presentation, because I think this topic is much more important for us to listen to the families and the patient's perspective than for me as a provider to espouse any specific directions. But nevertheless, thank you for the opportunity to at least kick off the discussion tonight. Can you see the whole screen?
Yes.
Perfect. So the topic today is very important, a transition of care for liver transplant recipients. And thank you again, Farah, for the opportunity and the most gracious of introductions, as always. Glad to
Thank
be here.
you.
So these are a few of my disclosures. I want to make sure that they're, of course, just online for a few seconds. I have research support from the National Institutes of Health and a pharmaceutical company through the National Institutes of Health in collaboration. And I consult for certain medications, which I will not, medications manufactured by these uh, pharmaceutical companies, but I will not be discussing any of these tonight. What I will be discussing today is the importance of liver transplantation, the gift of life. This is a beautiful child, Mia, whose story was highlighted with the parents' permission when she got a second chance in life after liver transplantation as a young infant. This continues to be the amazing story that was started back in the 1980s, which is liver transplantation for children. And this is a curve from a publication, a scientific publication, which talks about the survival in years and goes all the way out to 20 years, as you can see on this x-axis, where the children who had acute liver failure are compared to children who have chronic liver disease in terms of their survival. But the point is, we are measuring in decades now the survival of children after liver transplant. We're also looking at a more robust look at what the experience is. And this paper from Dr. Vicky Ng, which I highlight below the graph now, is talking about health status. What is the ideal outcome when children are not only surviving, but now we're looking into their quality of life, how many medications they're on, and what is their day-to-day activity? Are they as close as possible to a quote unquote normal life compared to other children? That's where we're at today. Um, we're doing great, right? So we knew exactly what to do. I'm not sure that is true. There are the plans that when we sit down and say we hope that every child gets the ideal outcome as defined by Dr. Ng in that previous paper. But then there's life, reality, where we have to surf on the waves that come across in our lives, in our day-to-day ups and downs of living with a liver transplanted organ. And that's where the balance is important. When you look at a specific case, such as this one, where you had a 15-year-old who today comes to your clinic, but was transplanted, just like Mia, for a chronic liver disease, say at 5 months of age. This is a hypothetical case, of course, and unfortunately had to go through bouts of acute rejection. And maybe during that journey after transplantation, from being a 5-month-old to now a 15-year-old, also the family had to relocate. And during that relocation process, there was a loss of follow-up to the pediatric liver team. Uh, the, there was changes in insurance, and there were psychosocial issues that came up in the family dynamics. These are all risk factors which lead to chronic changes, chronic conditions within the child's life. Relocation for a normal family. Our family moved from the Midwest to this beautiful place called Los Angeles about a decade ago. And that relocation caused a lot of stress within a family where there was no child with chronic disease. However, when you have issues with, like prescription medications, such as our children have to take who have a life with liver transplantation, insurances can lapse. Inadvertent non-adherence can creep in. And of course, there are psychosocial stressors that could lead to either psychology issues or even psychiatric consultations being necessary. These are all risk factors seen that impact the transition of care that we're discussing today. So yes, we have a clear path to saving a child's life now through liver transplantation. It is an accepted standard of care for certain conditions and that lead to liver failure or where life can be made better with changing the liver. However, the long run, we do have to now start thinking about improving these risk factors as well. And that defines the transition, where the metamorphosis of a journey of becoming a butterfly, so to speak, from a caterpillar, where you have to have a structured process, an active process, thinking about transition of care, not when the child is at the door of change of insurance at 19 or 18 or 20 or 21, but rather when they're 15 and in your clinic, starting to address those medical and psychological needs, which may or may not be linked to the issue of transfer, but definitely are real, such as we just mentioned briefly, medication adherence and insurance and so forth. So all of these are critical to the generation of an ideal outcome for the child, not just survival. A high risk period that has been defined through research work is the 10 to 15 years post transplant. That's when you go into young adulthood, where we are hoping to transition a lot of the care not only from pediatric providers to adult providers, but also from the parents and family to the child who's now a young adult as well. And that's a key period where we have to focus on this process. There are psychosocial risks, substance use and abuse, both prescription and non-prescription. Suicide risks arise. Chronic illness is a burden on the individual. These are all real risks that we have to bear, the individual and the family. The consequences could be graft loss, loss to follow-up, specific problems which are medical, morbidities, and God forbid, even mortality, of course, is a higher risk during this transition process. So what are the core elements of these challenges? There's the fragmentation of care. There's these barriers to access care. The tension between autonomy and versus readiness. Here's the car. Here's the keys to the car, but are you ready to drive? Are you ready to drive on the expressway? These are all analogies that are pertinent to a transition of care from the family, pediatric to individual and adult medicine. And of course, psychosocial, the bedrock continues to be there. When you think about how we address these things, cannot do it in isolation. You need a multidisciplinary approach. You need to start early, as I said, at 14, 15, these discussions have to start with education and a structured plan, step by step. At our institution, for example, we have a support system for this called the Center for Healthy Adolescent Transition, CHAT, or CHAT for short. I'll leave the contact information at the last slide as well. But what this involves is social workers, financial counseling for insurance matters and beyond, and of course, linking you to adult care providers, adult liver providers, hepatology. The strategies are a lot to do with common sense, but also a checklist is always important, even in this kind of situation. Insurance continuity is really important. Promoting adherence, talking about the importance for a 15-year-old that was transplanted when they were 5 months of age. They don't remember the disease, maybe. They don't remember how sick they were when their parents brought them to the emergency room or to the ICU or to the operating theater during the 12-hour, 16-hour surgery. They have limited personal memories of that incident. And therefore, the why, explaining to them why it's important to take the medicine every day, even if it's only one pill, to talk about the potential consequences of not taking the medicine in their terms so that they understand. And of course, psychosocial health and linking to adult care, like we talked about. So, again, as I promised you, I will not bore you to death with a 30-minute talk. We'll keep it brief and then go into a interactive session. The key takeaways, therefore, high level for me, are going to be these three. Transition is a process. We are dealing with a higher risk population, valuable population that we have put resources, personal, familial, and societal, to make sure that they have a beautiful, amazing, full life. So let's invest in the transition process through a structured and planned approach. That's the 3 points I'd like us to take away. A lot of this discussion was informed, that I presented was informed by this webpage where the American Association for the Study of Liver Diseases has a nice discussion on the clinical pearls of this transition of care process. And you can scan their QR code to get to that webpage. And of course, as I promised you, from our standpoint at Children's Hospital Los Angeles, we have a Center for Healthy Adolescent Transition. And here, the second smaller QR code is a link to that. And as I said before, it may be that the process is not a straight line, but we're there to support you. It takes a village, and we have a village of medical, psychosocial, psychiatric, and family social, psychosocial, and social support, insurance, and financial support ready to make sure that this works out in the long run. And thank you for your attention. I'll stop here.
Thank you so much, Dr. Kohli. That was perfect, perfect. So we will have normally, usually in this kind of webinars, what we do, one doctor presents, and then we have another 2 or 3 doctors that are doing roundtable. Today, it's a different kind of webinar. So our roundtable includes liver patients who have been with us and are a part of our Liver Health Foundation's family. So I will introduce our guests briefly, so the audience and also Dr. Kohli get a good idea of who they are and what age they are right now. So the first people I want to introduce are Maria and Shalini Bahrum. Maria and Emil's daughter is 14 years old. She was diagnosed with autoimmune hepatitis in October 2020 when she was 8 years old. After many misdiagnoses, she ended up at Children's Hospital Los Angeles, where Dr. Yani diagnosed her with autoimmune hepatitis. Shalini is living with her liver condition and knows that this is a lifelong journey for her and her family. We have invited Maria and Shalini to join us so they can benefit from Dr. Kohli's information and ask any questions that they may have. Thank you, Maria, and thank you, Shalini, for being with us. The next panelists that I'm going to introduce are Malachi and Sheree Carey. At the age of 11, as Malachi began middle school, his health massively declined. He was constantly sick, lost a lot of weight, and worst of all, no one could explain what is happening to him. After months of testing, a biopsy at Children's Hospital Los Angeles revealed an extremely rare form of liver cancer in April of 2019. After months of chemo, the tumor was reduced enough for surgery. The month following the surgery, the doctor delivered some hard news to Malachi and his family. Despite the successful surgery, he still had a small freckle-sized cancer spot on his liver. With the possibility of cancer returning, Malachi was scheduled and received a liver transplant, his gift of life, on November 25, 2019. Today, Malachi is a college student at USC studying music. He is also an actor, has been an actor since childhood. Malachi and his mother, Sheree, are here tonight with us to share their questions and also what they have gone through or possibly are going to go through. Our other panelists are Molly and Christina Clark. We knew Molly when she was only maybe 5 years old. But her story is this. 24 hours after she was born, jaundice set in. Molly's jaundice was serious and life-threatening. As her pediatrician checked her bilirubin every few hours, he took notice that her liver was not processing and passing bilirubin the way it should. This discovery landed her in neonatal intensive care unit. Shortly after diagnosis, Molly went under a procedure which took 8 hours. That's called Kasai procedure. Her surgeon was able to find a very healthy bile flow when doing the reconstruction. Today, our Molly is 16 years old, a sophomore in high school, and is under the care of Children's Hospital Los Angeles and Dr. Coley. She enjoys basketball, chess, piano, and crafting. Molly is interested in college. Actually, she's very interested in college. She's considering nursing to be a NICU nurse. Probably she wants to help the little kids like she was when she needed help, or CRNA. Or on the flip side, she might decide to become an entrepreneur and own a business. So her dreams are wide and she's open to a great future. Molly and her mother, Christina, are with us tonight. Thank you for joining us. Our next panelist is Mr. Aaron Jackson. Aaron was born with biliary atresia and had undergone Kasai procedure. His childhood was uneventful except for frequent visits to his doctors. Aaron says his friends at school and his family protected him and made him feel comfortable and normal. Her pediatrician at UCLA cared for him until he was about 23 years old. After that, Aaron was pretty much lost in the system with no care. He didn't receive care until he was 26 through his employer's insurance. By the age of 31, he was feeling very sick. His skin began to turn yellow. He could not concentrate on his job and felt tired with no energy. He eventually lost his job and was hospitalized, awaiting a liver transplant. Aaron received his first transplant on December 9, 2019, at the age of 37. Unfortunately, his body rejected the new liver. On January 14, 2020, he awakened from that cloud of uncertainty and being sick and was told that he is now owner of a new liver and a new functioning kidney. Today, Aaron is on a mission to inspire other liver patients and other human beings and help them move forward with hope and energy. He's establishing his own nonprofit to be a speaker of hope. Aaron is with us today to discuss his transition, which is different from others. And our next panelist is Suzanne McCarthy. Suzanne's daughter, Alyssa, has autoimmune hepatitis. Her liver disease journey started in 2019 at the age of 12. A routine blood work for her annual physical revealed that her liver enzyme levels were highly elevated. After ultrasound tests, she officially became a liver patient and began visiting her gastroenterologist at Children's Hospital of Orange County, or CHOP, in April of 2019. After a liver biopsy on February 14, 2020, Alyssa and her family learned that she has autoimmune hepatitis. She was told there is likely not a chance for her ever being cured of this autoimmune hepatitis, but she can control her disease by following the doctor's instruction and chasing her dreams. Today, Alyssa 18 years old, is a college student attending the University of Cincinnati. Her mother is with us today, Suzanne, and will speak on her behalf. That's one of the other issues that Dr. Coley talked about when your child is grown and moves away from home and all the things that will go with it. So to start the conversation and break the ice, and if you don't mind, I'll ask the first question from Dr. Coley. Dr. Coley, David is asking, when insurance dictates where a child's transition is going to go after aging out of pediatric care, do you or your team proactively reach out to the receiving physician to help educate them on the patient's condition and ensure they are well equipped to manage these rare diseases? Patients are often shuffled around once they age out of pediatric care. How do you ensure that those that you have cared for, often from birth, continue to receive the same level of care during their transition?
It's a very important question. And as I said during the presentation, one has to start early. We cannot wait till the time of transition is upon us to start the process. The process involves not only the choice of physician and team, but also the preparation of the individual and the family. So if you are 14 and 15, you have a long runway ahead of you, relatively speaking, till you get to 18 or 21 when you need to transition, depending on your insurance and specific requirements of the insurance. While we are preparing you to be independent and be in charge of your medications and then taking your medications, remembering your medications, renewing your medications, knowing who your insurance plan is at this time. Those are all step-by-step empowering the individual to become stronger. Similarly, so to specifically answer the question that was asked, when we do get to the point of choosing the adult provider team, we will work together with you, such as through the social worker department in any hospital, or in our hospital, we use that specific team, the chat team that includes social workers and financial counselors. And we, of course, as subspecialty, in our case, liver providers, also know which teams are accessible to the individual across the region where they're at. Obviously, we will be more knowledgeable about Los Angeles and California compared to maybe a region far away or a country outside the United States. But we try our best to evaluate once we know what choices your insurance and your rules of the employer you're working with, or the school you're working with, or the geography you're working with allow us. So we will definitely work together with you. The only caveat I put to that is that we have to start early. We cannot wait for the last minute.
Molly, did you have a question? No? Okay. An audience is asking a question from Malachi. Malachi, she is asking, how does a teen boy want to be parented with regards to having a liver condition? Parenting a kid with a chronic liver disease can turn into smothering the kid. What advice do you give to the parents? Turn your speaker on before you.
Can you hear me?
Yes.
Okay. I'm sorry. Can you?
This is Malachi, everybody.
Hi guys. Sorry. Can you repeat the question one more time?
She's asking, how does a teen boy with liver disease want to be parented? Because it's very hard. Parents want to be helicopter parents all over the kid and constantly watching over him, and it becomes hard. So she's asking, what advice do you have for parents? How did you want as a kid, as a young kid with liver disease, to be treated?
Yeah, that is a really good question. Honestly, I feel like I've always loved how involved my parents are with my health, especially with like taking slow steps towards my own adulthood. I'm already 18, but still kind of making that transition process into where I will eventually be managing my own health and all of those things. But I've been very grateful with how much my family's been here for me. Um, I think like I'm having to like sign all my own like medical work now, and that's like totally crazy and weird. Um, and but at the same time, it's great because it is a lot more in like my control. But I feel like too, it's like I've been through like my cancer experience and liver transplant that all kind of um, shaped how I want to live today, and being super grateful for the life and the second chance I've been given. And I think like I choose to like live out um, that way and like and how I make daily decisions, taking my medicine and all of that. And I feel like my parents have been a great amount of involved, but like a recommendation or advice to parents who are trying to look to um, look to parent their kids. I would say, gosh, I don't know. I think just being supportive of where your child is or your young adult, um, and where they are in their health journey, and pushing them in the right direction to continue to help like um, take care of their health and giving them the best advice you can. And that's what my parents have done for me, and really kind of walk me through that process. Or like now when we're doing papers and stuff, I'm filling it out next to them. I can ask them questions, all that kind of stuff. So I feel like kind of being there for your kid along every step of the process and really helping walk them through each step, um, kind of teaching them how to manage their own health. And I think that would be my advice, because that's what my parents have done for me, and I've been extremely grateful. So, yeah.
Do you live at home or do you live in the university housing?
I'm currently still technically living at university, but I move out next week. So,
Yeah,
yeah.
okay.
But he lives
Um,
close to home,
But I
yes,
so
live, yeah, I'm like an hour and a half away, so not too bad.
yes, yes. We kept our son with us until he went for his master's degree law school. Then he moved away, but we held him. I held him two hands. So, does any of our other panelists want to say something about this subject? Aaron, you were, how did your parents treat you, and how did you want them to treat you as a child with liver disease?
Yeah, it is a really good question. If I'm being completely honest, the hovering, the helicopter parenting never really stops, and for good measure, right? My mom, even till this day, she'll check on my appointments to see how my blood work is and to see just how everything is going, and I wouldn't have it any other way. My situation was just, like a little bit different. I mean, I'm now 42 years old and still receiving those calls from my mom. It's just reassuring. It feels really good. I think my advice would be just to have the conversation. As parents, you know that you're not going to completely let go. And any strong, like real strong mama bear, papa bear, they are never going to let go in the first place. So it doesn't matter what your child really wants. You know that you just want to keep a tight hold on them, like Farah said. My parents lost my older brother to sudden infant death syndrome. So when I was born and then I got sick, it was even harder for them. So I think that's probably one of the reasons why they hang on so tightly. So yeah, I think my advice would just be to have the conversation. Malachi has had the privilege of being just an hour and a half away, and I left. I went all the way to Florida to school because I felt like if I stayed at home, I would still be too dependent on my parents, and that was my way of gaining my own independence. But what happened when I went so far away is I lost a lot of care. The only access I had to care being that far out of network was college physicians, and anytime I got a little sick and wanted to see a physician there, they took blood and immediately they want to rush me to the hospital. And it's like, no, I know my blood numbers. Actually, everything is normal. No, I'm not coming back in. No, I don't need to have a discussion or call my parents. So I think what's important is to know your own medical history, to know what your blood numbers look like, and just to have a good knowledge of who you are medically and on paper. And then again, just ask your children what they really want. And if there are situations where they kind of want to take control, let them. But my personal advice, kind of, I think similar to Malachi, is like also like still hover though. Like we still want you guys to be around.
That's great. Suzanne, your daughter went to Cincinnati. Alyssa,
Yes. And
tell
so I
us
can
how.
kind of balance the two of them out. We
Yeah,
really had to kind of push a little bit more for her to be independent, knowing we're here in California and she's in Cincinnati. She was going to have to be pretty self-sufficient, going to get her own meds from the pharmacist, monitoring her own health, etc. And she's really stepped into wanting to make her appointments. So same thing as Malachi and his mom are experiencing. I kind of just little gentle reminders along the way to help make sure that happens. But we recently had a scare in February where I got the phone call that said, the area where my liver is hurting. Something's wrong. We're not sure what's happening. Of course, I'm across the United States in a panic, but she handled it beautifully. Got herself to the children's hospital there. They actually got in contact with her CHOC GI doctor here. They ran tests. We figured it out. And so it was a perfect scenario for a bad scenario to happen. But I was grateful that she knew enough about her, same thing as you're saying, Erin, knew her body, knew enough that something wasn't right and got herself the care she needed over there. And so that's why this is important for us too, because we're in that lapse of transition of care because she'll be there for at least 3 more years. So
yeah,
yes, thank you.
yeah. Dr. Coley, there is a question that I want to read to you so you understand it. I'm not quite getting it, but it said, it says the lady, Nidia, is asking, what are good ways to help older teens with transplant, especially if my son has autism as a co-occurring diagnosis with ADHD and is good about meds when he has them in pills form, but struggles filling them up himself. What
Right, right.
recommendation you have for her?
I think structure is key. Um, Obviously having a backup plan for and behind that structure, but uh, for any child, and especially a child with special needs such as ADHD or autism, we definitely need to have even more structure and support available. What do I mean by that? So if you have a medical bracelet, for instance, these days there are many bracelets that allow a lot of information to be stored on them and easily accessible to, say, emergency providers or in an emergency room. They can scan it and get that information. Have a list of your allergies or a list of your medications. Outside of a bracelet, sometimes on the phone, you can have emergency contacts, and within that contact, you could have more details, again, of the medications and conditions that can be accessible to people in need when they're trying to help you in an emergency. For medication refills, there's a lot of automation available. I, for my own medicines, guilty as charged unless the pharmacy texts me that, hey, your next refill is due. I usually will not remember it. So that is part of the structure. These reminders, whether they come from our things that we set up or our partners in pharmacy or in our physicians' offices, there has to be a methodology, a structure that is established for all children and especially for these children.
Thank you so much. The other question that I wanted to ask, let's wait a second, ask Christina and Molly. Molly, what are you guys doing about preparing for Molly to go to college? And I don't know where you're going to be going, but who knows?
Well, we still have 2 more years of high school, so we have a little bit of time. And
Yeah,
Dr. Coley gave us the talk on our last appointment, and I was a little sad, but I understand transitioning, and Dr. Coley's been so good to Molly, and she's been super healthy. Some of it is the medications, which Molly's fortunate she doesn't have medications, but she has vitamins that are required. So reminding her and, trying to set up a schedule, as many of you have already said, setting up the schedule, making sure that you're taking it at the same time, and then seeing that, oh, there's not so much left and we got to reorder. I'm currently ordering them, but she's just saying, hey, we need more meds. Um, I think the other thing is pretty soon here, starting to make her own appointments. And maybe, I don't know at what point she starts going to these appointments without me. The mama bear will want to go, of course, like everyone has already said. But Molly got her driver's license today. Yes, so there will be.
Congratulations, Molly. Be careful.
So that is one step towards trying to give a little bit of freedom. I told her I was going to follow her to school tomorrow.
I would,
So-
yes.
It's, trying to give a little bit, more ownership to her to take care of these things. And she is currently interested in moving away for college. I don't know if I want to take offense to that or not, but she wants to go away. And where that takes her, I don't know. But I think as, Aaron and Malachi and Suzanne have already said, we'll continue from the back end to give a little bit of support. And I still ask her on occasion, how are you feeling? Is there anything off? And she knows her body, just like Alyssa did, and she knows when she's not feeling well. She knows, oh, wait, I have a little bit of a fever, something's off, and she knows what she needs to do, and we'll talk through it. So preparing her, I think at least having the conversation with Dr. Coley last year was starting to get our minds around that. Right.
I have, go ahead. Go ahead, please.
No, I was just, if Molly had anything else on that.
I really feel that it's a journey, and that conversation last clinic visit was just the first step. It's putting us on notice, all of us, including me, that we'll have to transition Molly out at some point, healthy, but to the right people. And as she makes her decisions on where she's going to be, we'll help her along the way. Congratulations, Molly, on the driver's license.
Yes.
Thank
I
you.
have a couple of questions that I can kind of put them together. So Nurse Anita is asking, how do I navigate the HIPAA laws that require I speak to the new adult patient when the parents are still managing or still want to manage their care? Then there was another question that came directly to Susanna. Maybe that will be something that we can talk about. It's asked, did the hospital talk with you when your teen went in without you there? There are so many privacy laws now that require adolescents have privacy. Dr. Coley, do you have something to say about that? Then we can ask the panel.
No, it's very important to have a open and constructive relationship between the parents and the now young adolescent, young adult patient. Because once you cross over from 17 years and 364 days to 18 years and 0 days, suddenly the medical responsibility legally falls on the individual and no longer sits with the parents. And the young adult has to now afford permission, very rightfully said, whether you're going in for a emergency room care, or you're going into a clinic room, or you're having a conversation on a telehealth visit or on the phone call. The presence of the family member, parent, caregiver is based on the permission, expressed permission of the individual young adult. And so, yes, there is privacy that we have to respect, privacy laws that we have to abide by. And having these discussions when they're 15, 16, 17 probably helps when Mr. Jackson is 42 and his mama and papa bear are still involved, right? So that's the therapeutic relationship that exists between an individual that has chronic, unfortunately, long-term care needs, medical needs, and their family. I will say that this is really important. Hence, again, the point being, start early, building that bond of trust between the family members.
So, Shalini and Maria, this is now something that you should start working on. I know it's a few years, but as Dr. Kohli keeps saying, that you have to get prepared for it. It's not something you jump in the last minute and make it work. Yes.
Yes, thank you so much for having us. This is a lot of information and it's very helpful. She's only 14, but I'm glad that I started at this time. So thank you for the opportunity and thanks for everyone sharing your stories.
So, Sheree, did you want to say something?
Hi.
Hi.
Yeah, I feel like a helpful piece of information that we didn't find out until Malachi turned 18, but I feel like it would be good to know prior, is to meet with an attorney to start the legal process, and so that you have your child's permission for ROIs, for release of information, that you know their advanced health, what they want to play out. They actually have to make these decisions on if something were to happen, what their wishes are. And it sounds, it is for me, it was a little hard, but it was very important that we did that. And I actually keep it on my phone. So I actually keep that on my phone in my files. I've also hand carried into Children's Hospital Los Angeles that information so that they have it in their care. He still is a patient there, but when he transitions to the Keck Center, to USC, instead of Children's Hospital, we will obviously do the same thing. And what that allows is us the ability to still have interactions where they can actually call and talk to mom with his permission. So I feel like that's a really important piece, and you have to get it notarized, and but it's easy. It's actually not a long process. We were with an attorney for about an hour, and we had the information and the paperwork that day. So I feel like that's something that I would highly recommend just kind of having in your mind ahead of time, because I didn't find out until he was 18 and all of our links shut off at the hospital for our access. And that wasn't CHLA's fault at all. It was our own fault for not understanding the process. Anyways, all that to say, it was very helpful once we got that, so we could have like a mutual agreement for us to get the information, him to approve it, and the hospital to be able to talk to us.
Yeah, that's really interesting. You don't think about that when it's your child, but you still have to go through the legal process.
Yeah.
Yeah, interesting. Christina and Molly, you're listening to all this, and also Shalini and Maria, because these are the steps you have to take. And Suzanne, you said you haven't transferred her insurance yet, or her care, have you?
No, her insurance is still covered. We haven't transferred care yet. She's still through CHOC, Orange County. So we're in the process. We have an appointment when she returns here shortly, and then we'll be deciding next steps. But yes, we've been talking to her GI doctor frequently in the last, I would say, year since we knew she was going to be going across the United States about transition of care. And yeah, it is. And one of the other piece of advice I would give is we've always let her know, even when she was younger and under 18, and we were there for her appointments, that if she ever wanted to talk to her doctor privately, that she could do that. So sometimes, she wants to ask her doctor something and not in front of her parents, especially at 18 now. But I think that allowed us to keep the open relationship where she still wants us to come to her appointments because she knows she can just ask to talk to them by herself.
Oh, very good. Very good arrangement. Now, Aaron, you didn't have insurance when you was moved out of pediatrics. How was that for you?
That was kind of a challenging situation because I think for about 3 years I really didn't have any care. I mean, thank God that I didn't have any issues during that time. But Dr. McDermott kept me until I was 23 years old, and she gave me the absolute best care. But there was no real handoff. There was nobody that I could even speak to that could help with that transition of care, because I left and went to college and I stayed there for a period of time. And then it wasn't until I got back and I got my first job that I got insurance and got care again. But even still, the hepatologists there just weren't really aware of what biliary atresia is. And so it was important for me to try and advocate as best I could. But at that time, I didn't even really know what my disease was. This is a time where we didn't have Google. Like the only access I had to information was to pick up an Encyclopedia Britannica and try to flip through the pages and see if my diagnosis was in there. But there was nothing in there. I think the percentage is roughly 30% of biliary atresia patients even end up as adults, because most patients get their transplants by 10 years old. And so here I am in my 20s, and I couldn't advocate for myself because I wasn't really aware of what my disease was. And going into the system that I went into, it was just patient after patient after patient. Every time I went in the waiting room, it was crowded, it was full of people. And to just be seen, it was like 10-minute visit. Okay, numbers look the same. Mel scores this. See you next time. And so it wasn't until I left that system and I returned back to where I had been originally that I finally got the care. Dr. McDermott was able to partner with the teams that were there and actually handle an actual transition. And I think that's the first time I felt secure and felt like I was at home. And that wasn't until the age of 29. So I went probably from 23 to 29, just kind of lost and
Okay.
going to the doctor and just not really receiving the care that I should have.
Yeah, that's horrible. That's feeling really bad because you know you're sick, you need help, but you have no access. And also, one of our audience is saying it is very frustrating that you cannot reach your children's account and the hospitals to see how they are doing. So what they did, they instead of legally, they got a letter of recommendation from the kid that they could actually see the process. I assume it's very hard. I can imagine how hard it's for the parents not knowing
Yeah.
what the situation is. Yes, Dr. Cole.
I think it goes back to the point about being prepared. I think Malachi's mom was saying it very right. If you know what to do, it's not that hard. But if you get surprised, it can be frustrating logging in and not seeing, whether it's during the period of adolescence where the portal can disappear because you need your child's permission to access their records, or after adulthood as well. So those transition points can be jarring, but if you know that you have to slow down before the speed bump, then it's not that bad.
Dr. Coley, before we finish this tonight, I know we have questions. I had a big list of questions to ask from audience, but if you were to give three most important things the parents have to do to prepare for this transition, could you please name them?
I think the three things I would think about would be, one, having a therapeutic and trust-filled relationship with your child. That's probably the most important thing. And that's true of whether your child has a chronic disease or not. I would want to have that for all children and their parents and their caregivers. In this specific instance, I think the number two is making sure that they know, the child, young adult, knows their medical history terms, the things that Mr. Jackson was talking about, and medications. And finally, I would say that being prepared and having a structure ready for those bumps that are going to come predictably at 18, at 21, and all the legal bumps that are going to come on our way. So trust, information, and being prepared, preparedness. Those would be the three things I would talk about.
Thank you, Dr. Coley. As usual, I really appreciate you being with us and bringing all this good information to us. We are grateful for your partnership. And thank you to our wonderful roundtable participants. You brought so many good information to everyone, and these are real life experiences you shared with us. I think we will do this again because it was really wonderful. Thank you, Miram Pharmaceutical, for your support. We appreciate your partnership in serving liver patients. MASH educational webinar is coming up on June 18 from 6 to 7 p.m. Pacific time. As you may know, fatty liver disease is an epidemic, not only in America, but around the world. In this webinar, we will learn about what causes fatty liver disease, what is MASH, how it develops in liver, and how can we live a healthy liver life. And our expert will respond to your question during webinar. Please go visit our website and register. Our website is liverhealthfoundations.org. On May 30th, we have our big event in OC, Orange County. It's Liver Health Screening, Health Fair, and Walk for Your Liver, Orange County. The event will happen in Irvine. We are excited to be back in Irvine for a wonderful event. We will offer free, non-invasive liver screening to all registered individuals. All the screenings will be done in privacy, and the doctors will respond to all questions. We will have doctors who will speak 4 different languages. The co-chairs of the walks are Dr. Brian Lee, co-director of Hoag Liver Program at the Hoag Digestive Health Institute, and Dr. Harry Warren, assistant professor at University of Irvine School of Medicine. The event will include our customary walk around the park, music, breakfast, and more. So please visit our website and register. And happy Mother's Day to all mothers, grandmas, and great-grandmas, and any woman who has ever given a tender, loving care to a child. And then to our audience and our panelists and Dr. Kohli, thank you so much. We hope everybody received the information they needed. We wish everyone peace and freedom around the world. Have a wonderfully meaningful and safe Memorial Day. Good night, take care, and be well.